society has made a push to make conversations about mental health happen more often. Some of this was fueled by the pandemic.
Among Americans surveyed earlier this spring, roughly half said the pandemic had a negative effect on their personal mental health.
And of the parents polled, more than half said the pandemic negatively impacted their child's mental health.
Still, this spotlight on our mental well-being can't overcome the obstacles people face in getting help, like the stigma surrounding mental health services, the financial burden, including navigating insurance programs to see if services are covered.
An event today aimed to knock down those walls. KSHB 41 News reporter Jian Kim learned why two groups felt that now was the right time to bring a mental wellness expo to the Metro.
We have more children coming to our emergency departments with suicidal thoughts or attempts than we ever have before.
Sarah Schlegel with the KBC Health System says the ongoing mental health crisis is at an all-time high following 2 years of isolation during the pandemic. So today they put people who can be a part of the solution into a room.
Some kids are really good at hiding depression. I think my son was good at hiding depression.
Kevin Timmons lost his 22-year-old son Nick to suicide in 2017. He's pivoted the mission of his foundation for the kids to address mental health in honor of him.
Just in 1 week, he lost a job and he lost a girlfriend, and on one horrific night, he lost hope.
Other panelists talked about what needs to change at the grassroots level, starting with the stigma.
It brings this sense of relief from so many people when they hear another person say, oh, I've got to go see my therapist.
Emily Snow with Blue Cross Blue Shield of Kansas City encourages parents to normalize these conversations in the home.
Are you thinking about hurting yourself? That's not going to cause them to hurt themselves. And so the best thing you can do as a parent or a connection or a support is to talk and connect with those children.
Schlegel says local resources are there, but there's never enough.
That starts from the top down, right? And so if we feel like we need additional mental health services, it's contacting your local politicians over your communities, your cities, your counties, and advocating for the increase in funding and attention to those needs.
Jian Kim, KSHB 41 News.